Welcome to Conversations on Healthcare. This week is part 2 of our look back at the last half-century of contributions made to the growth of community health centers. Veteran journalist Thalia Assuras resumes her conversation with our hosts Mark Masselli and Margaret Flinter now on Conversations on Healthcare.
Hello and welcome to Conversations on Healthcare. We're continuing our conversation with your regular hosts, Mark Masselli and Margaret Flinter, on what is a special edition, special because we are marking the 50th anniversary of Community Health Center Incorporated and also celebrating this show. Let's talk about this. Let's talk about this very program. Your very first guest, I said I wasn't going to get into politics, but your very first guest was Speaker of the House, Nancy Pelosi. And you have national folks on your broadcast. Margaret, why did you feel this program was important to add to your center?
Well, I'll give Mark credit for the original idea on it, but it immediately made sense to me in part because selfishly, it allowed us to call up the best, the brightest, most innovative people in the country and have a conversation with them. I mean, I could have just done that by myself, I guess, but much better to have it through a radio show. But in all seriousness, most importantly, it created a forum to talk about important issues in healthcare writ large, right? We were talking policy, innovation, technology, sometimes politics, occasionally clinical, and certainly during the time of COVID, a big focus on a major clinical issue, but from the policy, public health, politics, economics, communication perspective. And if you go back, as I recently did, through all the shows, which our fabulous communications team lines up for us because I would not remember all of them, the range is astonishing. From people no longer with us, who I'm so glad we captured, Jack Geiger, Fitzhugh Mullen, Uwe Reinhardt, people who are legends in their time, but kind of preserved for posterity with their thoughts, to very recently speaking with a family physician in Ukraine who couldn't disclose her location because of the bombings that were going on, and who said, we take care of our patients when the sirens go off, we run to the shelter, and then we come back and we take care of our patients. So this enormous universe of both intellectual and really policy changing work that's going on. It's been such a pleasure to bring that to the forefront of the country. And also some of the people we've interviewed over the years, if you go back 2010, they were back in 2014, 2018, because they continued to increase in their influence throughout the United States in a positive way. It's never been a gotcha show. It's always been about bringing people's thoughts, their ideas, and challenging them, but bringing that to the forefront.
And Margaret brought up the point that the pandemic has had a special place, obviously, on the broadcast recently over the last, it's almost 3 years. What stands out for you there? And because you've actually, as they say in the news business, committed news. You've broken news on many fronts.
Well, let me just tell a story because it's just the three of us, right?
Please.
Okay. So I wanted to take us back to that Speaker of the House, Nancy Pelosi. So we're probably a month before we started the show. We said, let's get out. And I think, as Margaret said, we wanted to bring the lens of community health centers to the conversation and really get a focus in on the populations that we care for. So we thought we were going to do a local show, frankly. We thought this was going to be Connecticut-based. And a friend called up and said, the Speaker of the House is coming into the state. And I said, by the way, we're doing a radio show. You think she would be willing to call in and do the show? And it was a good friend, congressman back then. And he said, I think I can arrange it. So we had her scheduled for 11 o'clock at a radio station, WESU, Wesleyan University College Station. At 10:55, the entire station went out of power for 2 hours. And you can imagine we've lost the Speaker of the House. We had this all set up. And, the technician said, "Why do you care about the Speaker of Connecticut's House?" We said, "No, this is Nancy Johnson." Finally, the power comes on. We're dispirited. We're sitting there. The phone rings. "I am so sorry I'm late calling in. This is Nancy Pelosi." So,
calling from the back of a taxi.
And nobody told her, right?
No one told her. And it worked perfectly. So I think there was sort of good karma, if you will, on that. And that's not dissimilar to when we had Dr. Anthony Fauci on in February of 2020. Before he was a household name, he came and spent a half an hour talking with us about this pandemic that was in Wuhan, China. And he really said some things that really put the hair on the back of my head on edge. He noted that every day there were 20,000 Chinese who fly into the United States. And we knew once he said that, that was not just that day, it was every day that this had already reached our shores. And the other thing that he noted, and I think is proven true, he said, the coronavirus, they mutate. They just do. And so we that early on, and we helped translate, I think, for a lot of people who listened to the show, they did as we did after we heard that conversation. We went back and prepared ourselves. And we've had, Ashish Jha on, who's now the new COVID leader. For those of you who are listening, in 2 hours, we're interviewing Deborah Birx, whose new book just got released. She'll be on our show later today. It's being released today. So we've had the opportunity, because of that lucky, the luck of the Irish or whatever, in terms of the speaker coming on, we've really had the ability to reach out, have conversations, but also conversations through the lens of people who live in poverty and organizations like ours all across America who make a difference in providing them. We've been able to bring important, critical, and credible information to them.
And Margaret, let me pick up on COVID. Both of you have talked about it, but CHC Inc. really put together a lot of solutions when people were, in general, across the country, healthcare systems, hospitals, physicians were flailing. What do you think you learned and brought to the table and will take forward?
Mm-hmm. Well, first of all, I think that everything that we learned over the course of the 47 years that led up to it was put into play. Mark talked about, enduring adversity, overcoming it, and moving forward. We were not strangers to crises. We weren't strangers to being in a position where we really didn't have any experience about the best way forward. We hadn't been part of something like this before, but we'd had the experience of being in the situation of not knowing. And what we did know is that strength comes from pulling together the team. And that team is not necessarily by rank and hierarchy, right? That team is by who can contribute to solving this problem. And so, Mark, I think was this Sunday, probably the Sunday before it really broke on the national news, Sunday afternoon, that we pulled everybody together. And we made the decision that there'd be no layoffs or furloughs, which was already becoming, the word on the street. Thank God, because we needed every single person that we had and a couple of hundred more to do what we did. And then we'd have to execute on a couple of levels. One was to make sure we maintained our commitment to our patients. We had to take care of them. Didn't matter if there was now this pandemic, even more so we need to take care of them. But to do that safely, we had to reorganize everything. And we did that. Clinical chiefs, operational chiefs, facilities people just did a spectacular job. We also knew other people like our dentists, our school-based health center nurse practitioners and therapists and hygienists who the schools were about to be shut down, that they couldn't do what they usually did. And honestly, worked for us, that they were able to become the nucleus of whole new categories of jobs that we'd never had before. People to do COVID testing, mass testing, outdoors, so it was safe for everybody. following up on those results, educating our patients constantly, and really trying to be the crosswalk between primary care and public health, and to take care to the people. And we've talked about our special populations. The homeless are one of our special populations. We have a whole program called Wherever You Are, is the name of it. And that was really the philosophy that carried us through the COVID pandemic. Wherever you are, we will bring the testing, we will bring the vaccines into homeless shelters, into tents down by the river, into mass 8-lane drive-through clinics on abandoned airfields and in shopping malls. But it took that initial group of people coming together and signing up, many of them to work 7 days a week, probably for the better part of that year, to make it happen. And while it was exhausting, it was probably one of the most exhilarating, unifying, purpose-driven episodes in the history of the health center.
And I can't imagine, Mark, that you had ever thought you'd be, setting up drive-through vaccine sites, for example. I mean, all of this is new to everyone.
Yeah.
How did you do it?
Well, I think, we have an operating phrase here that we want to make things efficient, effective, and elegant. And we did that in terms of the design of the mass testing sites. And as Margaret said, this was an opportunity for young people who had never been in leadership to end up doing our mass testing sites. We had them 20, fix them, and dozens of mobile ones. But that work got the attention of the governor's team here in Connecticut. And they reached out to us and said, we need a mass vaccination site set up. We had never set up a mass vaccination site. Meredith Johnson, one of our leaders here in the health center, was up at Rensselaer Field and looked out and saw that there was an abandoned airport, Pratt & Whitney's abandoned airport. And they said, can you set up here? And we said, we will. And in 1 week, we set up an entire village that was able to ultimately, throughout the state, do 8,000 vaccinations per day. And it was really a tribute to the partnerships that we had with the National Guard, with the state of Connecticut, but the leaders within the health center that Margaret described earlier, who came from all walks of life, were able to set these up. And we really, that one airfield was the second mass vaccination site set up in the United States. I think Los Angeles had the first one by about 18 hours. But we just had to use all of the resources that we had built up in the health center. But we also just had to unleash the power of these young people who wanted to step into leadership roles and make a difference. And so, we were able to do that. We ran them from East Hartford to Stamford to Danbury and to Middletown. And they ran 7 days a week. There was no let up. And for the most part, like the Pratt & Whitney Airport, it had no power, no running water. We had to bring all of those in.
And what other innovations beyond the COVID facilities you set up, Margaret, would you say have been primary for CHC Inc.?
As a result of COVID?
No, beyond COVID.
Oh, beyond COVID. Well, now we have to spend a couple of hours here to talk about all of our innovations.
You have 1 minute.
That's good. I can use that kind of thing. I will say one of the innovations that is now no longer thought of as an innovation because it's actually become a central part of healthcare in the United States was this idea born out of our experience of caring for low-income, uninsured people who didn't speak the language, as much as we could do for them in primary care. They needed specialist care sometime, and just try and get a specialist appointment for an uninsured, low-income, or person who speaks another language or experiences transportation. I always say I could probably throw a softball if I was a better pitcher and hit 2 or 3 major academic medical centers in Connecticut, but it didn't mean I could get an appointment with a neurologist or a gastroenterologist or an ologist of any kind. And we took a kernel of an idea created by a wonderful fellow Dr. Mitch Katz when he was health director for the city of San Francisco, called the e-referral, because he asked the question, does the patient need to go to the specialist, or could the primary care provider consult with the specialist in an organized and disciplined way? and determine the best course of action, including managing the problem in primary care. We took that kernel of an idea and created a national model of e-consults that today is operating around the country. We have an affiliate for it called ConforMed. Proven, published results in terms of the quality, the safety, the efficacy, and the cost savings of the model. And that's just one of, literally thousands of examples that we could give you of specific innovations that are making a specific difference in healthcare today.
Yeah.
I want to move, Mark, to something a little bit different, because I understand that you see a connection between your initial passion for healthcare service when you were a young person and the challenges to the environment today. Where is that connection? What do you mean?
It's such a great question, and that connection is so important. Margaret and I have the unique opportunity that we've taken on to interview everybody who's a finalist to work at the health center. It's no small task. There are about 1,500 people who work for us. So every day we have new people who are coming. And we hear, in part, we want to see them and hear them. But part of the conversation is animated by their interest not only in healthcare being a right and not a privilege, but the planet that they live in. And, I think any organization that doesn't have an environmental focus is going to lose this intellectual capital that exists with our young people who are very worried about the planet. And we are as well. We have set up our own environmental task force. We've built gardens on our rooftop. We have mobile gardens in a number of our schools. We're trying to think through how we can play an important role in it. It may be planting trees in urban environments, but it's really about capturing in healthcare the role the environment plays. In the last 7 years, we've had 3 of the hottest summers in the history of recorded meteorological data. We see these enormous wildfires that are happening out in Arizona and California and in the West. People are breathing bad air. And guess where many of the environmentally pollutants are housed? They're housed in low-income neighborhoods. So we have a responsibility as an organization to speak truth to power on this and to develop intervention models. I will tell you, sort of back to the issue of innovations at the health center, we often say that our real strength is borrowing an idea and returning it with interest. The Mitch catch is one example, but so often, because of our contacts around the globe, we're hearing about great ideas. And through our Weitzman Institute, we're able to translate that into a workable, scalable model that can be returned to community health centers around the country. I think that's our real skill, is to listen to other people carefully, grab that kernel of an idea, which is so insightful and so brilliant, and really translate it into a program. This is going to be very important for us on the environmental issues as well as we move forward over the next 50 years.
Just very quickly, yes or no? And are these young people passionate about these environmental issues, those you speak with, Mark? Do you see hope ahead?
Yes.
Thank you for the yes or no answer. And finally, because there's so much to talk about, but to wrap up, and Margaret first, what advances in medical care do you see ahead? I know just through this COVID period that the way I have to deal with healthcare questions has changed. I've not been on so many Zoom calls in my life and find it kind of strange. Is this where we're going in healthcare, and what else?
Well, I'm forever optimistic, just sort of born into my genes, I think. And I do believe we have the national attention at least the policy level focused on transforming primary care as that first rung. The National Academy of Science, Engineering, and Medicine issued one of their landmark reports, the first one in 20 years on primary care last fall, and really boils down to saying we know what great primary care is, asterisk. It's just not what most people in the United States experience today. And it's care that moves away from the fee-for-service system, is team-based and comprehensive. It's about a team of people caring for you. It delivers more to the people who need more. It's science-based, but it also understands that there are community elements and forces that need to be integrated. And more than anything else, we need to get it done, and we need to address it in a way that, as we've alluded to earlier, understands that health equity is about life itself, that we have just huge discrepancies in the very length of life between groups of people because of their health conditions, many of which are born out of social determinants of health, adverse childhood events, but can be ameliorated through really excellent primary care, whether that's in the health center or in school-based health centers or any place else. So that's sort of the big structural piece, and we will continue to fight for that on every level. But then there's this other piece that we finally recognize as a country, and Francis Collins was on our show a couple of times, the now retired director of the National Institute of Health, who created the All of Us program, right? Who recognized that we are massively different and that we now have the science and the knowledge of genomics to understand that we need to treat people individually as well as members of a group. We have to study that. The All of Us program, of which we were one of the first participants as an organization, is the largest research project underway of our times to really look at how do we look at the impact of genetics on each individual's care, but also the interplay of genetics with family, neighborhood, environment, and personal habits. So a lot of exciting things ahead for us, I think.
And Mark, what do you see ahead?
I think it builds off of this, the smartphone. 12 years ago, this wasn't in anyone's hands. It has transformed the delivery system in so many ways, and it will only get better. We need to figure out ways to give people access to healthcare without necessarily saying, you know what, you work at 7-Eleven and guess what you have to do? You have to get into 3 buses. They're going to take you an hour and a half to get here. You're going to have to wait in our room for an hour, and you're going to have 15 minutes with your provider. That is antiquated. We need to get rid of that. And really, mobile devices are going to be so important. The price point has dropped down from, and we've been measuring the use of smartphones over the last couple of decades and technology, but I think it's going to transform the way we deliver care. So we have to be on both sides of the aisle, high touch and high tech. High touch because people need to be reached out to. We need to go to the farm workers where they're working, or the schools where young people are being educated. But high tech because we need to drop these barriers that exist that are so anti poor people in that they are forced to lose income because we simply haven't figured out a technology solution. Both are going to be important for us. We're going to still need to have that conversation where I can look you in the eye, I can say good morning to you. On the other hand, when it's appropriate, we're going to be able to use these devices for remote monitoring. Our friends in the West Coast have developed an ultrasound off of the iPhone. You're going to be able to do EKGs. You're going to be able to do so much on monitoring. And we have to have our feet in both of those worlds to continue to build a world-class primary care system that's focused in on special populations, committed to improving patient outcomes, and cultivating healthy communities.
So much more to talk about, but I have to say, we've come to the end of our discussion. I want to thank both of you, Mark and Margaret, and congratulate you on 50 years, you and your team, and also congratulate you on this program. And thank you again for letting me sit in your chair and flipping the table on you. Thanks also to our audience at home for listening.
Thank you, Thalia.
Thank you so much.